How many? Yes, in adult human body, there are 206 number of the bones are there and 360 number of the joints are there. So in case of this one, whenever there is a, somewhat changes are there or the disease condition is there, in this one particular case, the joints are there, they shows the inflammation that indicate that the person is suffered by the joints or the pain in the joints are there. Likewise, this is the conditions are there, these are the joints are there, we have to be observed in this one particular joint. The what is the cartilages are there that are to be destroyed by some means, and there is a somewhat granular structure is there that is we observe in this one particular joints, and this leads to the disease condition that we call it as arthritis. Arthritis in our body, there are 206 number of the bones are there and 360 number of the joints are there. So each and every one joint is shows somewhat functional, but because of the certain disease condition, the joints are there that shows inflammation, and the condition is there which we call as arthritis. This condition may be occurred due to the change in the season is there, or some of the disease conditions are there that pains or the inflammation is there that is we observe. Near about more than 100 means near about 127 different kind of the arthritis are there that are to be observed. Mostly these arthritis conditions are nothing but your rheumatoid arthritis is there, gout is there, and osteoporosis is there. Now we see that what is rheumatoid arthritis. Rheumatoid arthritis is a severe inflammation is there which is be involved in the joints, that because of which the joints are there that are to be moved beyond the musculoskeletal system is there. Now we have to see in case of this one particular condition is there which is to be observed in the bones. This is a type of the rheumatoid arthritis condition is there because of which the gap is there that is to be observed, and because of which what is the movement of the bones is there that is beyond the musculoskeletal system. The second one condition is there that is a gout. In case of this one gout, there is a painful, means severe pains are there that is we observe in the arthritis, which is to be characterized by the formation of uric acid. Now, this uric acid is there that should mostly occur when there is a acid formation is more than the normal, and the excretion of the uric acid is very less. Then that uric acid is there that is deposited in our body. Nowhere that uric acid is there that is deposited, but it is mostly found in the joints, and because of which it creates a problem in the movement. And the condition is there is known as a gout. Means gout is nothing but a very painful sensation of the arthritis is there. It is one of the type of the arthritis is there in which the granular structure is there that she form because of the uric acid, and it creates a severe inflammation where is a redness, swelling, such type of the symptoms are there that she observe. This gout is there mostly observed in mostly in case of the toes are there as well as the fingers are there, that the gout condition is there that she will observe. The third one is there that is a osteoporosis is there. In this one particular case, there is a progressive degeneration of the joint cartilages are there. There the blue color cartilages are there that we have to be observed, and this one blue cartilages are there that is we observe, and there is a degeneration is there that should occur in minor degree, and because of which the minor degree of the inflammation is there that should occur. If you're not going to treat this one or heal this one particular disease condition, it may prolong and the person may suffer by the walking conditions are there addition of occur properly, the balance condition is there is to be not found properly in that one particular person, so that the treatment is there that is essential. Now let's see the gout. What is gout? Now, in this one particular case, I told you that gout, in this gout, the uric acid deposition is there that you occur, which is not to be excreted throughout your body, and because of which the excess swelling is there that she found in the foot portions are there, near to the toe portions are there, and just below the palm of this one particular legs are there. There is a swelling is there that you should observe. Most most of the time, you have to be observed that the at the night time or early in the morning, there's a severe pains are there that is we observe in the legs, or ankle joints are there, or the toes are there, that this is because of the gout, because excess uric acid secretion is there that is occur, and this uric acid is deposited into our body because of the improper purine metabolism. We are going to take the excess quantity of the tea or coffee or some of the food materials are there, that it leads to the deposition or as well as the formation of uric acid, and that is responsible to cause gout. Gout is a metabolic disorder of the purine metabolism, which is to be characterized by intermittent attack of acute pain. Means severe pains are there that is found immediately, and swelling as well as the inflammations are there that is we observe. This is the symptom of the gout is there. It is always preceded by the hyperuricemia, where the normal range of this one particular uric acid is there is about 6 milligram per deciliter is there. Hyperuricemia due to the excess amount of the uric acid production as well as the decreased excretion of the uric acid, means uric acid is there that is deposited in our body, whereas mostly that uric acid there that is deposited into the joints, and that leads to the problem or the pain as well as the inflammation in the joint, that is nothing but is your gout condition or arthritis condition is there. The hyperuricemia is there that is mostly is of two types, that is a primary as well as the secondary. The primary hyperuricemia is there that should be classified as a overproducers or under exciter, or we can say that less exciter is there. Now let's we see that what is the difference between this one primary hyperuricemia as well as the secondary hyperuricemia is there. In case of the primary hyperuricemia, gout with no associated conditions are there. Means in this particular condition, primary hyperuricemia is there. There is a no exact reason is there that should be observed, or we can say that because of this one particular condition, the uric acid level is increased or that should be appears. In this case, there is no any particular reason is there that you observe. Uric acid is there that is to be under secretion near about 80 to 90%. Uric acid secretion is there that you occur. Idiopathic condition is there, means we cannot judge why this is to be occur. What is the exact reason, that is to be unknown. That is nothing but is your idiopathic condition. Then urate overproduction means near about 10 to 20%. What is the normal production is there more than that 10 to 20%, the excess quantity of the uric acid is there that is we produce in case of this one, that is a HGPRT deficiency, which is to be responsible. HGPRT, the role of this HGPRT is there that is we convert this one excess production into the proper metabolism, which is to be responsible for the easy excision. HGPRT is nothing but is your hypoxanthine guanine phosphoribosyl transferase enzyme is there, which is responsible to convert this one and decrease the uric acid level up to the normal. If there is a deficiency, then this one particular condition is occur, that is the excess production of and the storage of the uric acid. Then next one is there, that's a PRPP synthesis. That is a overactivity. If there is a HBPRT deficiency, there's a overproduction of this one PRPP and overactivity there should occur. That is a phosphoribosyl pyrophosphate is there. Now, secondary hyperuricemia is there, that is where the exact reason is there that should be known. Yes, this is because of this one particular condition, or that food is there that you have to be consumed, so that there is a excess production of uric acid there that should occur. It is occur because of the during the course of other diseases are there in your body, such as your leukemia is there, lymphomas is there. Then if you have to take the chemotherapy, then because of this one, the condition is there that is occur, that is your secondary hyperuricemia condition is there. Some of the drugs are there that is also responsible to cause increase in the uric acid level, such as your thiazide is there, then diuretics, then furosemide, erythro. Ethacranic acid is there, that is also responsible to for this one particular condition is there. Then some of the disorders are there, that is a diabetic ketoacidosis is there, then lead poison is there, then lymphoproliferative disease is there, then hemolytic anemia, then psoriasis. All these conditions are there that is also responsible for this one. Then it have a dual mechanism such as your obesity. Some of the person is are obese one, then hypoglycemia, then hypoperfusion. Likewise, these conditions are there that is also responsible to show or increase in the hyperuric acid level. Now, in case of this one, uric acid production as well as the excretion, if you have to study the cycle, that is to be totally depends on the DNA as well as RNA, where the purines are there that should be plays an important role to the various type of the food materials as well as the some of the soft drinks are there that were to be consumed, then tea preparation, coffee preparation, through which the purines are there that are to be goes into our body, where phospho ribosyl pyrophosphate that is we plays an important role in case of this one, which is responsible to convert this one purines into the hypoxanthine. Uh, Last time we see that this PRPP overactivity is there. PRPP, if there's a overactivity is there that actually occurs because of which hypoxanthine, then xanthine oxidates. This plays an important role where the conversion of this hypoxanthine is to occur into the xanthine. And xanthine oxidase is responsible to convert this one uric acid, where the low water soluble contents are there that are to be formed. Usually the uric acid is there that's soluble in case of the water, but because of this one, there is a low water soluble, means the crystals are there that are to be more saturated and that are not to be soluble easily in water, that is not to be excreted throughout your body, that is to be remain in your body, and that is to be responsible to show symptoms such as your hyperuricemia is there, because of which gout is there that you occur, then that crystals in the form of the needle shaped crystal, that uric acid crystals are there that are to be deposited in the soft tissue such as your toes are there, then heels portions are there. Likewise the then nephro lithiasis is there, that conditions are there that will be occur. Uric acid is there that you freely filter through by glomerulus as well as the reabsorbed by tubular fluids is there. Now, the next one is there pathophysiology of the gout is there. The normal level of the uric acid in women is there near about 2.5 to 7.5 milligram per dl, whereas in case of the men, it is about 4 to 8.5 milligram per dl. But because of the some conditions or some disease condition, if you are having some treatment, the uric acid level is there in the blood is goes on increasing, so that that uric acid is to be reacted with sodium crystal, that we can say that toffee, that is to be deposited into the soft tissue and joints, and because of which the inflammatory condition is there that is to occur. In this one particular treatment, if because of this one the excess quantity of the uric acid is there is found, in that case we can use indomethacin as a drug of choice to decrease this one particular inflammatory condition or to control this one. Whereas the infiltration glomerulate, then phagocytosis, the urate crystals are there. In this case, we can use the colchicine. The exact mechanism is there is not to decrease this one particular level or to stop this particular synthesis, but it is we know to bind with this one particular content, and that is responsible to decrease the side effects of this one particular uric acid. Then, what is the infiltration glomerular? That phagocytosis urate crystals are there that generate the free radical damage in the tissue, and in that case, we can use the colchicine also. The release of the proteolytic enzyme, that is a glycoprotein, release of the lactic acids, and in some case there is a release of lysosomal enzyme that causes the destruction of the joints, because that is to be deposited in that one particular joints, and more precipitate of the urate crystals are there that is to be occurs in that one particular region, because that particular crystals are there that should form, that is to be saturated and that is to be deposited in that one particular regions. Now the next one is there, that's a acute gout. Means immediate. The gout is there, gout condition is there that you form. In this one particular painful arthritic attack is there, or the sudden onset of the action is there. You know that at night time we are feel very relaxed condition, but at midnight there is a pains are there, or early in the morning there is a pain in the joints are there, or the heel region is there. That is nothing but is there is because of the acute gout condition or arthritis condition is there. It usually occur at the night or early in the morning. Arthritic pain worsen progressively. Means what is the pains which are to go for that is become more severe in that one particular conditions. Generally, it involves one or a few joints. It is not like that one single joint is there that should be involved. Sometime more than that joints may be formed in this one. The most common site of the initial attack is there, that is metatarsobopharyngeal joints are there. Then other sites are there such as your ankle, heel, knees, wrist, elbow, and the fingers are there. Now the chronic gout is there, that is a frequency. Chronic means from the long term, that gout condition or the uric acid is there that should remain in our body. That is a high level of the uric acid in our body is there. That is, the frequency of the attack is increases, continuous deposition leads to the damage to the joints as well as the chronic pain is there. Then patient may develop the large subcutaneous tophi. The tophi means we can say that the stones are there. Here we see that some of the pinnas are there on that one particular, the knot-like structures are there that we have to be observed. These are nothing but is because of the uric acid formation. The knot-like structure is there that show off, that is known as the tophi condition. Then on the eyelids also, such type of the conditions are there. Then on nose, such type of the pain swelling is there is found, and not like structure is there is found. Then in case of the finger, the swelling is there that is found. These are nothing but is because of the uric acid. The urate crystals in the kidney leads to the renal disease. If that crystals are deposited into the kidney, it may cause a renal disease. Then articular cartilage may destroy, result in deformities. Then treatments goals. Before going to give a treatment, we have decided some goals. First one thing is there. Firstly, we are going to terminate acute attack. Sudden attack is there, which is to be we reduce, or firstly we give to the relief to the patient from the attack or acute attack. Provide rapid, safe, then anti-inflammatory relief. We have to give this some type of the drugs are there we have to be given, such as the drug which decreases the pain, then inflammation which gives the relief to the patient also. Prevent complications such as your destructive arthropathy is there, then trophy, or the stones are there, then renal stones are there, we can say kidney stones are there. That conditions are there that have to be minimized. Now, the second drug choice is there, that is a NSAID drugs are there, that is a non-steroidal anti-inflammatory drug. Means steroids are there that are not to be present in that one particular drug, such as your ibuprofen is there, paracetamol is there, diclofenac sodiums are there. Such type of the drugs are there that are to be given. Second one choice is there, that is the corticosteroids are there. Then third one is there, colchicine is there. Initially, we are going to give the non-steroidal anti-inflammatory drug. Then second one colchicine. If there is no relief because of this one particular drug, then the third one, that is a corticosteroid therapy is there that should be given. Chronic gout means from the long term person is there that should suffer by this one particular uric acid signs are there, and because of which the pain and the inflammation is there, that is nothing but your chronic gout is there. Inhibit the uric acid synthesis. We have to give such type of the drug that inhibit or decreases the uric acid synthesis. As the uric acid synthesis is there that should be decreases, then there is no pain, no arthritis condition is there that should occur. The drug of the choice is there, such as your allopurinol is there, then febuxostate is there, that is a allostatic one. Second one is there, that is a increased uric acid excretion. By any way you are unable to control the uric acid formation, the excess quantity of the uric acid formation is there ratio for, then in that case you have to give the uric acid excretion. Such as the diuretic drugs are there, you can be used, such as your probenecid is there, then sul, sulfenazole is there, that is the uric, such type of the drugs are there that you can give to the patients. Then next one is there how this colchicine shows its effect. Colchicine is neither analgesic nor anti-inflammatory, means it does not have its pain killing property, or we can say that analgesic property, or it does not have any role in case of the inflammation, means it neither shows its pain killing property nor it shows anti-inflammatory property, but it has some specific gout inflammation. It is only effective in prophylaxis of the gout. Acute gout is there. Whenever the acute gout condition is there, in that case, colchicine type of drug is there that should be given. Then you think that how this one drug shows its action. It has no effect on the synthesis as well as the promotion of excision. Means colchicine not plays any role in the uric acid synthesis and nor in uric acid excision. Now, this one colchicine binds with the intracellular protein. We can say that is a tubulin, and it causes depolymerization and the disappearance of microtubules in case of the granulocytes, and it inhibits granulocyte migration, means transfer from the one side to the another site. So, the phagocytic activity is there that will occur in case of this one, and in this way, colchicine plays an important role. Now, colchicine inhibit the glycoprotein release. Other actions of the colchicines are there that it arrests the mitosis in metaphase, that is the spindle poisons are there. It increases the gut motility, then antipyretic, then respiratory depression actions are there. It inhibit histamine. You well known that histamine plays an important role in case of this one inflammation. So that it inhibit the histamine release, then insulin is there that should be released, then hypersensitive at high dose, then increases vasomotor tone, direct vasoconstrictor actions are there that should occur because of the colchicine. Next one is there that is a non-steroidal anti-inflammatory drugs are there. The strong anti-inflammatory drug as compared to the previous one, colchicine. Yeah, it the maximum dose is there. Is not to be given because it is a somewhat potent one. Some of the drugs are there here. The dose are there that are mentioned. Endomethacin that is to be given near about 50 milligram TID, means 3 times a day. Diclofenac sodium or diclofenac is there that is near about 50 milligram TID is there. Then ketorolac is there that is near about 10 milligram is there, that is the dose is there. Then naproxen or piroxam, this proxicum. These are the drugs are there which are to be given. Continue until the pain or the inflammation is about or absent for 48 hours. Just you have to give the drug of the choice for this one. Now, how this one NSAID shows its mechanism of action. It inhibits the urate crystal phagocytosis and the chemotatic migration of the leukocyte into the inflamed joints. NSAID are not recommended for long-term treatment because it may cause some diseases or toxicity conditions are there. Salicylates are not used. They have tendency to raise uric acid. We can say that aspirin-like drugs are there that are to be used as a painkiller analgesic. But in this one particular case, aspirin type of the drugs, if there is not to be given because it contains uric acid as well as, salicylic acid is there that is found, and that may increase the uric acid level. Corticosteroids are there. Whenever the colchicine as a non-steroidal anti-inflammatory drugs are there that is not able to show its action, then in that case, the corticosteroids are there that are to be given. Whenever the elder persons are there that are hypertensive one, then peptic ulcers are there, then renal impairments are there, liver impairments are there, and NSAID are not able to show its action or as a pain killing property or inflammation, then in that case corticosteroids are there that are to be given. The drug for chronic gout is there. In this case, the uric acid synthesis inhibitors such as allopurinol is there that you given. Allopurinol is nothing but your xanthine oxidase inhibitors are there. This hypoxanthine is to be converted into the xanthine and laterally is converted into the uric acid, where the xanthine oxidase plays an important role. Where the allopurinol, if you are to be given, allopurinol is a short-acting competitor. Allopurinol prevent the synthesis of uric acid, means uric acid formation by inhibiting the enzyme that is the xanthine oxidase, which is responsible for conversion of this one particular apoxanthine to xanthine to the uric acid and results in decreased plasma urate level. This is the mechanism of this action is there. This is of allopurinol drug is there. In this way, we have to cover this one gout as a arthritis. Next time we see that rheumatoid arthritis. Thank you.